Welcome to the office. Hi, Megha.
Hello,
Welcome to the office.
Thank you so much.
Nice to meet you. So we're at the new office, or the remodeled office. This was our original office. And Megha is our first patient. She's our first patient here.
I'm so glad to be here.
That's awesome. And you're coming from?
Atlanta.
You're coming from Atlanta.
Yes.
And your bodyguard is over there on the side.
Yes, he's
okay.
there.
He's going to make sure we're doing the right thing.
Yes.
Okay, so what brings you to the office? How can I help you?
Actually, I have a constant pain in my back and my left leg. Sometimes when I walk for a long time, then I have pain in my right foot.
Okay.
And sometimes here also. And I'm not able to sleep on my right side.
Hold on. Low back pain goes down your left leg.
Left leg.
So it's more sciatica.
Yes.
Okay. And then how about the middle and the neck?
It's not that bad.
Okay. And then what's happening in the right leg?
Right leg, when I walk for a long time, suppose 10-15 minutes, then I have pain here at the
On the ankle or the bottom of the foot?
Bottom, not bottom, here. This one.
The whole foot?
The whole.
Take it. Okay. And how long have you had this?
It's been 3 years now.
3 years. Before 3 years, no issue?
No issues.
And any trauma, any accidents?
Actually, I was doing some yoga, extensive yogas, and one day I was trying to touch my feet, bending over, and then all of a sudden when I was trying to get back, I had a pain, and after that it started.
So you were bending over for a yoga pose,
Yes.
touching your toes,
Yes.
straight legs,
Yes.
not bent, right?
Not bent.
Okay, and then as you were coming up, you started to feel it.
Yes.
And you felt it catch, or you felt the shooting pain?
I felt it. I felt that something happened here. Some noise was there. I don't know.
Okay.
I just realized.
Little
something
popping, cracking sound?
Yes.
And since then it's been like
been
that?
like that,
You
yes.
haven't seen anybody in Atlanta?
No, not in Atlanta.
Then
But
where did this happen?
It happened in India during
Okay,
COVID.
okay,
Yes.
okay.
And then now whenever I try to sleep in the night on my right side, I can't sleep because I have a pain here.
In the low back?
Lower back
And
is
that-
this.
On the right side?
Right side.
Nothing in the middle, nothing in the neck?
No.
Okay. And you haven't seen anybody for this? No chiropractor, doctor, anything?
No, nothing.
Okay. So why did you come all the way here then?
To fix it.
Okay.
I feel this is the best place to get it fixed.
Well, I appreciate that. Let's see what we can find. The idea is we want to get an answer, right?
Right.
So we did our full spine x-rays already. And guys, so you know, that door leads to the x-ray room. Okay? So, that way everything is now in-house for everybody, so it made our life a lot easier. Okay, so what we're going to do is this. Let's go over your x-rays. There's a lot I need to go over. After I go over your x-rays, we'll do your exam. We'll figure out where we're going to start.
Okay.
We have 24 bones in the spine that move. We have 23 discs in between. This is your back profile. This is the right side. Okay, I did the analysis of the pelvis here as well.
Okay.
And normally in the older videos they see this on this side, this on this side, but now the room has switched, so I've kind of changed the screen. This is your side profile, lateral profile. And we want to talk really first about this x-ray because it's kind of important to understand what's going on, okay? So I'm going to go into this and let's take a look. Okay, so we said 24 bones in the spine, right? This is the foundation of your 24-story building. What are some of the things that we see here? We do see a tilted pelvis. And because of this tilted pelvis sacrum, we see this curvature going to the right side. Take? Okay. Now, it goes to the right. Now, if the body didn't compensate, then where would the spine and the head be? It would be way over here. And there's a reflex. This is important for everyone to understand. We are biped predators, right? Biped predators, we have our eyes in the front. We are born with an innate reflex called the righting reflex. The righting reflex states that the body will do everything and anything to maintain the head straight and eyes level. So I know you've seen people like this walking, right?
Yes.
I'm not talking about the people that are walking like this,
Yes.
but the tilting. And that's based on the righting reflex, little evolutionary history trivia. So the compensation that's happening is in the middle back, and then what happens here? It straightens out, and then it kind of curves again this way, right? Now, there's something that I like to do to see if the body has compensated completely or if there's any change that can still happen, okay? And the first line that I'm going to run is going to be from here, S1, and we're going to go straight up. And if it goes through the dens of C2, which it does not, this is the dens here, then, so if this line from S1 goes through the dens here, this is the dens of C2, then that means the body has already fully compensated. There's nothing to change the structural appearance of the body. Sir, can I have you cross your arm, uncross your arms, please? Energy, sorry. No problem. Okay, so in your situation, there's a little change that can happen from what I see here. But now let's go to the foundation and see what happened. Birthing, do you remember any issues in birth when you were born? Did mom tell you anything?
No.
Normal birth that you recalled that?
It was a normal birth.
Normal birth, okay. So let's look at your foundation, and I'm going to give you your answer today, okay? Here's what's going on. We have a tilted sacrum, number one. You have an 8 millimeter drop on the sacrum. The question is, was this due to a tailbone injury, number one, or in her case, there's something else? You have this finding right here. This is your L5 vertebrae. You have what's called a spatulated L5 transverse process on the right, forming an accessory joint on the sacrum. Have you been told this?
No.
Okay. Why is this important? Okay, let's just say this is the transverse of 5. Let's say this is sacrum. This is fusing on this side. So it's the sacrum is tilted and the transverse here is fusing. So the question becomes, was it initially a trauma that started the tailbone injury and this grew like this? Was this and I see quite a few cases like this. Or is it that this was growing like this and it was pushing the sacrum down? This happened in childhood, by the way. This isn't something new.
Okay.
So all these years we've adapted. And a lot of the patients that I've seen with this, we've maintained them. That's it. Okay? We've maintained their mobility. There's some exercises we'll talk about later on. So this is the answer. We have the sacrum on the right side drop down. It's rotated only 1 millimeter. That's not so bad for me. Okay? But where do I see it tilting from? I see it tilting from here. S1, S2, S3 is where the tilt started. Now, I'm going to go to the lateral film so we can see. Was this normal or, and there's your answer. So there was an old childhood tailbone injury.
Okay.
And that's our answer. So you can see it goes like this. There's a hard bend right there. Am I going to fix that bend? No, because it's already fused. Look, I can work on the coccyx if I need to. We can see this is open. But this bend, there's no joint there. That's the bone that's formed. So the idea in your case is going to be finding your stability, your stable point.
Okay.
And it's probably going to mean having some sort of periodic maintenance. What does that mean? Okay, it doesn't mean you're going once a week to get adjusted.
Right.
And we'll find somebody in Atlanta for you. Okay, we'll find somebody in Atlanta. Maybe you're going a couple of times a year.
Okay.
You get your teeth checked?
Right.
A couple of times a year? You get your spine checked. Spine's more important.
Yes.
Okay? You can always get dentures, guys. You can't get another spine. Not yet. Okay, does that make sense?
Yes.
Okay, teak. Let's continue. Let's go back to this. So the answer or today is probably going to be starting somewhere in your tailbone, number one. That's causing this curvature in the spine. You're telling me that it started as the pain going down the left side. And that's probably the slight rotation of that sacrum, probably. But most of it now is you're feeling on the right. And you understand hopefully now why.
Yes.
Okay? As it goes up the spine, there's just compensation. And now we want to get to this upper cervical. I'm going to move this line now. Okay? And let's look at the upper cervical and let's see what do we find over here. So what we're seeing, all of this is compensation, madam. Because you can see the neck starts to deviate to this right side.
Yes.
And then what happens here? It has to compensate here on the upper cervical. C2 is also tilted. All of this is tilting down. And then we have some jaw deviation on the right if you want me to look at your TMJ. I know there's some jaw issue as well. And I'm assuming there may be a little popping or clicking on the left side.
Yes, it is there.
But you didn't tell me, right?
Yeah, but I feel that it's because of my teeth, maybe.
It's because of your jaw.
Okay.
Okay. So I'll check it for you if you want. You don't have to do it today, but we'll do it in one of the visits for you. Okay? Questions on your x-ray? On this x-ray. Next thing, let's go over your lateral film. And let's give you some good news. But first, let's check your posture. Now, if we're looking at both x-rays, okay guys, and we see that there's curvature on the first x-ray. What's more important to me with this situation, do we have the right sagittal curves or side curves? And we are designed to have 60-degree reciprocating curves. You have a great low back curve. You have a good, actually great mid back curve. You just need a little more curve in the neck, tiny bit. And that's going to be some posture stuff that we'll go over later, okay? Besides the adjustments. So because of that, you'll be able to maintain your situation. Does that make sense?
Yes.
Now, let's go look at your discs and let's see what we have in the discs. 4 is tilting, 3 is tilting, 2. This is all from what we saw in the low back, right? So this is compensation. The discs are good, discs are good. This was some sort of old compression injury, maybe playing sport or something happened. And when we look at your neck is decent. We have a little bit of tilting going on at C6. Your discs are good overall. Okay, so I'm happy with that. We'll see if there's any pressure there in the upper cervical, okay? And in the cervical spine. Any questions on the x-rays? We'll get started.
No.
Okay, let's get started. So we're going to start the exam on the cervical stool. We're going to start with visualization. And what are some of the things that we see? I'm going to bring these down if that's okay, madam. I have to see your dimples. And hopefully I'll be able to address a bunch of questions people always ask too, like why do we gown the patient? And in the Gonstead work, we gown everybody, okay? And that's the way we were taught, that's the way he did it. Why? Because we want to look at the whole spine. We want to look at the symmetries, we want to look at the blemishes, we want to see the overall tone. Okay, you can't see that too close. You can't. And then people are wondering, why are they this and that? Then it makes a big difference, okay? Let's go ahead and look at her posture. Sit up straight for me. Now, is that comfortable for you to sit like that? Okay, sit what's comfortable. So right now, this is comfortable, and you can see the tilting right here, okay? Go ahead and sit up straight. I want you to see. If she tries to sit up straight, you see more of this pronounced. So it does this, comes up, like this. Okay? So one of the goals is to figure out stability at the foundation so she can sit properly. Okay, sit whatever's comfortable first. Starting at the base of the neck. And the first thing we're getting is 10 points, C6, left side. Doo-doo. Now, let's see if we get a break here. Relax the head, madam, thank you. I'm not really getting a break up there, but I'm getting heat. Let's see. There it is. Down in the basement. S3, S4, maybe S5, and C6. Those are the two spots I'm getting first right now, okay? Now we're going to go ahead and statically palpate. Static palpation. No, you don't move. You don't move now. Head down, please. You okay?
I'm okay.
Static palpation. Running our fingers down the spine. What's your activity level? What do you do for activity besides yoga?
I do walking, only walking.
Lots of walking?
Yes.
Any sport or gym? So your homework here is going to be just walking anyway. Round your back forward slowly. There you go. Head down. Plus.
We had started swimming in between, so I would not sure.
So even with the curvature stuff, there's not a lot of inflammation here. It's pretty good. Veg?
Yes.
Veg? Non-veg?
Yes.
Moms are going to watch, so you better say.
Yes.
Veg.
I mean,
Please, Jane.
Right SI joint, left SI joint. Punch. 1, 2, 3. Right there. 4. Punch. 4. 4. S4. Let's try that. S1. S2. S3.
Yes, it's there.
S4. Right?
Yes.
S4. Now, let's go ahead. For the SI joint, I'm going to go back slowly towards me. Top of the joint, middle of the joint, bottom of the joint. Okay? Middle of the joint.
Middle and bottom both are.
Okay. Left side, top of the joint, middle of the joint, bottom of the joint. Not too bad, right?
Bad.
So, this is the right side, S4. Okay? Tick. Next, let's check the neck. Sit back for me, please. There you go. It's a whole different vibe in this office. It's cool. Come back slowly towards me. 6, 7, 6 on the right, 6 on the left. Sat. Tender there or there?
There.
This one? How about that one? Not too bad.
It's in the left side. Right?
So when I go to the right versus the left,
I feel
so,
like there is a stretch.
okay, relax the head. We're going to wait on the neck. We're going to start at the foundation.
Okay.
Okay? Fair? Now the next thing I want to do is see you walk. 1 second. Okay, come over here please. Sorry. Come over here and you're going to walk a straight line back and forth several times. Let me go up here. Go ahead and walk to the end of the room and back 2 times. Keep going. You can see she also has dropped arches. She's a pronator, but more importantly is those arches, both arches have collapsed, medial arches. So I'm sure we have to work on her ankles too. Okay? All right. Keep going. One more time. So we have an idea now, this is her walk.
yes.
Okay?
Don't be conscious, you are walking conscious. Do your
Regular walk, regular walk.
Yes.
You're from what part of India you said?
Maharashtra.
Maharashtra.
Yes, it's from Pune.
Pune. Aga Palace is in Pune.
Yes. Shaniwar Park.
Uh-huh. Okay, so we have an idea now of her walk. We're going to get started. We're going to come over here onto the Hylo. You're going to step on the black platform. Okay, and we're going to go down. Let me just bring this down 1 second. Okay, come on up. And you're going to go, once it goes down, you'll slide up a little bit more, okay?
Okay.
Cool. And we got the new table. All right, hands forward, please. All right, slide up, madam. Okay, hands forward, hands right over here. Okay, palms up to receive.
Okay.
There you go. And we're good. So we're doing S4, right side. Now we're going to do we're going to have to torque it up in order to start to bring the sacrum up. Okay? How you doing? Good? Decent? Cool. That's the home run. That's the home run, madam.
It's here.
Yeah.
Feel it.
Now you wait. Step off the table slowly with me. Okay? And what I want you to do is go ahead and you're going to walk your line, please.
There is a difference.
Look straight ahead when you're walking, please.
Maybe a normal look.
A little different now?
Yes, it's different.
What's different for you?
So earlier I was walking like this. Now like this.
Keep going. Let me open the back of your gown, please, so we can see better. There you go. Now you can see when she's walking, there's more movement in the hips, there's more stability in her walk already. Take. Pretty cool. Come back over here, have a seat. All right, right over here. And let's run the meter and see what changed. Now, do you see how you're sitting? It's more comfortable to sit up straight. Dekho? Sir?
Yes. At least the sitting posture has changed. Immediately.
That cleared the neck at the bottom. All the way from Atlanta for one S4 adjustment. That's pretty amazing.
Special for
S4. Saf safai ho gaya. Check it out.
it was coming return last time. The meter reading.
It's
at
zero.
the bottom is-
Okay.
Yes, it's no pain.
Ek.
Yes, it's there.
Do, teen.
Yes.
This is the one I adjusted.
Yeah, that no pain.
And
But
it's moving now.
yes.
Now I want you to understand, this is going to be tender regardless right now. This is the transition segment, L5.
Okay.
Okay? As we get more movement, sorry, right there.
Uh-huh.
That's the transition.
Okay.
As we get more movement and you get more walking, things will start to shift.
Okay.
Okay? Now let's check. Bolo.
No, that's fine. I just have pain here. Maybe you said that it will.
It's
get
different
fixed.
though, right?
Yes, it's different.
more, it's gonna be more of like a soreness.
Yes.
And remember, we're moving something that's never been moved before.
Right.
So the body is going to fight a little bit.
Yes. Resistance.
Head down, please. Nope. All clear. Okay, next thing we're going to do, let's go ahead and start on your ankles. And what I'd like you to do is lay on your back over here, please. I'm going to work on the ankle. The sound is the board. One, two. Back on the chair. And let's use the machine. Now buff and polish time. All right, madam, why don't you walk it off again, please? And let's take a look. That should be a lot less now.
Yes, it's pretty
Straight.
straight.
Awesome. Over here, please. Sorry. Stand over here. Let's check your hands. Software engineer?
Yes.
What kind of software?
The web development mostly.
Very nice. It's so funny. He's
It's
laughing.
always funny for me.
Yeah, relax there. Lunate. Squeeze. Squeeze. Relax there. Lunate. Scaffold. Squeeze. Yes. Squeeze. Squeeze. There you go. Turn and face that way, please. Let's see the ears. She listens?
Yes.
Ah.
Now she's gonna listen more. I'm
Yeah.
joking.
No, that's
joking.
fine.
Okay.
It's stress.
She was listening for my response, but what I say.
Okay, so we're all set for today. Okay, we
Mhm.
figured out what the issue is. We're starting on your S4.
Mhm.
As you do your movement, your homework is very simple, 10,000 steps a day.
Okay.
Shesh is gonna give you something for some inflammation.
Mhm.
You get as much movement, enjoy LA for a few days that you're here.
Mhm. Okay.
And at the end, we'll give you some instruction and
Mhm.
let's find somebody for you to continue the care over there.
Okay.
Okay?
Yes, definitely. Thank you so much.
Do you have any questions?
No, I don't have any questions for
You?
now.
Do you have any questions, sir?
Does the flat foot that she has affect her in her walking?
Both. It's like the chicken or the egg.
Okay.
So I don't know what she was like before,
Mhm.
okay? But the fact that they're there with the spine, we need to work on both. We
Okay.
get the ankles going good.
Mhm.
I will make a few suggestions on the feet later. Okay, right now, let's see what the body does with the adjustment first. You'll report back,
Mhm.
okay?
Yes.
Next visit.
Yes.
And good, this is not good, bad, whatever's different, different.
Yes,
Take?
definitely. Yes. Thank you.
Welcome to the
Have a good
office.
day. Yes. Thank you so much.